7 conditions that affect fertility in women. Female infertility can be due to several factors. Generally, any factor that blocks the sperm from reaching the ovum in the fallopian tube will lead to women's subfertility. This video highlights 7 conditions that may impact fertility in women. Ovulation disorders. Ovulation disorders where women ovulate infrequently or do not ovulate at all causes infertility in around 1 in 4 infertile couples. These disorders may be due to the regulation of the reproductive hormones by the pituitary gland or hypothalamus, or issues in the ovary. Older age. Women have the best opportunity to conceive in their 20s. This period is when they have the highest number of decent quality eggs, and their pregnancy risks are lowest. Endometriosis. Endometriosis happens when tissue which normally develops in the uterus implants grow in other places. This additional tissue growth and its required surgical removal can result in scarring, obstructing the fallopian tubes and preventing the egg from uniting with the sperm. Unhealthy body weight. Having a passive lifestyle and becoming obese or overweight can increase a woman's risk of infertility and are at a greater risk of getting a miscarriage. Women may also have fertility issues if they experience an eating disorder, such as bulimia, anorexia, or following a restrictive diet. Abnormal cervical mucus. The cervix secretes a cervical mucus fluid, which enables sperm to survive in the vagina's acidic and hostile environment. Abnormal cervical mucus can inhibit sperm from approaching the egg. Tubal problems. Blocked or damaged fallopian tubes can hinder sperm from reaching the egg and prevent the fertilized egg from reaching the uterus. Some typical causes of tubal issues are sexually transmitted diseases like gonorrhea and chlamydia, resulting in PID or pelvic inflammatory disease, and prior pelvic surgery. Uterine or cervical problems. Several cervical or uterine causes can affect infertility by disrupting with implantation or increasing the risk of miscarriage. Uterine or cervical issues include benign polyps or tumors, uterine abnormalities since birth like abnormally shaped uterus, cervical stenosis, and the cervix's inability to produce the ideal mucus type for sperm to travel smoothly from the cervix to the uterus. Women planning to conceive should speak with their gynecologist from a reputable Singapore women's clinic and get regular recommended health screening Singapore to determine if they have a particular condition that may affect their fertility.